At the entire heart, you have your, if you start with the great vessels, you have your pulmonary trunk, you have your aorta, you have your superior vena cava. If we lift this up, you would see the inferior vena cava here, and then you would have your pulmonary veins here, and pulmonary arteries there. Now, if we follow pulmonary circulation, these pulmonary arteries would go to the lungs. You would have gas exchange. That oxygen-rich blood then would come back to the heart via the pulmonary veins, right? And those will drain into the left atrium. We know that the vena cavas are returning blood from the systemic circulation, right? So this is oxygen-poor blood coming back and draining into the right atrium. The pulmonary trunk then is going to be responsible for sending that blood to the lungs, and then the aorta is going to be responsible for transporting blood to the systemic circuit. Now for the human aorta, you see three branches here. The one on the right is the brachiocephalic, in the middle is the left common carotid, and then the one on the left is the left subclavian. So
and the cat only has?
The cat only had the brachiocephalic and the left subclavian. On the anterior aspect here, you see the auricles. This is your right auricle, the left auricle, your atrioventricular sulcus, or your coronary sulcus. Here's the anterior interventricular sulcus. Now you see the left ventricle and the right ventricle. As far as the coronary vessels, you have the right coronary artery here. And as that goes around, it's going to give rise to these marginal branches. On the left, we can't see the left coronary artery. It's actually going to be deep to the pulmonary trunk. But we do see where the two branches that come off of that artery eventually make their way out. This branch is the anterior interventricular artery, and this branch is the circumflex artery coming around the left side. The large visible vein here is the great cardiac vein, and this will go all the way around. If we look at the posterior aspect for the coronary vessels, you have the posterior interventricular artery and the middle cardiac vein. And then finally you see the large coronary sinus, right, where all of the venous blood from the coronary circulation drains, and that then drains into the right atrium. If we look at the internal anatomy, you see your chambers, right? Atria are the superior chambers, the ventricles are the inferior chambers. So right atria, right ventricle, left atria, left ventricle. Remember, as far as determining what side is what, you always look for the thicker ventricular walls.
So this is left ventricle?
Yes, left ventricle, right ventricle. Again, look at the thickness of this wall compared to this wall. And the reason for that is, remember, this has to pump to the entire systemic circuit. In the center, you see the interventricular septum. These structures represent the AV valves. On the right, you have the tricuspid valve. On the left, you have the bicuspid valve, or the mitral valve. These are going to be the chordae tendineae, the little string-like structures that we saw in the sheep heart. You can kind of see them on that model a little bit better. And those are going to be anchored to the papillary muscles. When the ventricles contract, blood is going to make its way into these great vessels. When the ventricles relax, that blood is going to start draining back. To prevent backflow into the ventricles, we have the aortic semilunar valve, preventing backflow into the left ventricle, and the pulmonary semilunar valve, preventing backflow into the right ventricle. And then as blood pools in here, that's what ultimately will supply the coronary arteries.